The Infectious Disease HIV and AIDS and the Impact that it has on the Homosexual Latino Men in San Francisco, California, by Danielle Curtis, Nicole Raycock, and Roger Connor. Target population. In San Francisco, 1 in every 4 gay and or bisexual men are infected with HIV and AIDS. Each year in San Francisco, about 86% of gay and bisexual men are newly diagnosed with HIV. A majority of all Latino men move to San Francisco because, unlike other cities, they are able to have more sexual freedom and gender self-expression. Identification through assessment. The biggest problems on why gay and bisexual men are being infected with HIV and AIDS can be contributed to their risky lifestyle behavior, having unprotected anal sex, and intravenous drug use. Many gay and bisexual men feel like since they are already infected by the infectious disease that they can continue with risky sexual behavior when they should be preventing the virus from spreading any further. Those of whom are infected are affected by the virus in several different ways, such as practicing seroconcordant relationship, which is being with someone who is also infected with HIV. Also, one of the biggest problems is that those gay and bisexual men who are infected with the virus end up having a lot of mental problems that they have to deal with. Population. According to statistics, around 15,901 people are infected with the disease, making California one of the states with the largest HIV populations. After the first diagnosis, nearly half of the infected population refuses the proper care for more than 6 months, which allows the disease to actually get worse. For those persons diagnosed, more than 88% are taking the medication as well as other steps to keep the disease under control. From the years 2001 to 2013, gay Latino men suffering from the AIDS virus had a life expectancy of about 5 years, but which is actually longer than men diagnosed within the African American community. When a person is diagnosed with HIV and AIDS, other illnesses are likely to occur, such as cancer and pneumonia. Risk factors. From 2009 to 2013, the Latinos in California alone went from 21% to 25% in regards to HIV and AIDS contractions. San Francisco has a higher number of Latino gay men within the last 15 years with the disease. The Latino population in San Francisco does not only engage themselves in risky sexual behavior, but their past or current history has a filtering effect on the uprise of HIV and AIDS within their communities. Due to their economic status, they oftentimes do not have access to healthcare services, information about low-income programs, drug and alcohol use, and contraceptives. A Spanish prevention intervention called the Hermanos de Luna Huaso for Latino gay as well as bisexual men in San Francisco helps in dealing with the common history of oppression amongst the gay Latino men, including several issues such as homophobia, machismo, sexual abuse, racism, and separation from their family and culture. Demographic variables. Demographic variables such as age, socioeconomic status, family and community structure, and racial and ethnic composition have been demonstrated to have a direct reflection on the health of a community. Men who have sex with other men make up about 65% of these reported HIV and AIDS cases. Latinos make up 15% of the San Francisco population, but account for 34% of HIV/AIDS cases. This is a rate of 3 times the rate of whites. People between the ages 20 to 29 make up about 19% of the reported HIV/AIDS cases. HIV and AIDS exist in all levels of socioeconomic levels in society, but studies have shown that those who live within poor communities often suffer from the contraction of the disease at a rate that is significantly disproportionate to those of higher economic statuses. Social stigmatisms of those who live alternative lifestyles are associated with the resentment of them to take appropriate measures to prevent and protect themselves from contracting the disease and seek medical treatments as they should. About 48% of those living with HIV and AIDS do not comply with the healthcare requirements that are recommended. Cultural competence of Latinos has also aided in the reflection of HIV and AIDS incidence and treatment compliance in their communities. Having different religious and cultural background contributes to Latinos' inability to satisfy cultural expectations of a predominantly white population. Assessing the problem. Two services that aid in the assessment of prevalence of HIV within the Latino community in San Francisco, California is the Office of AIDS, the Center for Infectious Disease, California Department of Public Health, and local health departments. These organizations help to assess, track, and review the prevalence and occurrence of HIV and AIDS within the communities of Latino population. HIV infections and AIDS diagnoses are reported through a combination of both passive and active surveillances. Passive surveillance is conducted through state-required reporting of HIV and AIDS cases by healthcare providers and reporting of HIV-positive tests from laboratories to local health departments. Local health departments are relied upon heavily to perform active surveillances, on-site chart reviews, and case reports. Addressing the issue. There have been numerous programs that have been available to men of the Latino race that are living homosexual lifestyles, but the Pacto Solar program seems to be the most effective. The program was set up as a day-long retreat where men were able to channel their personal aspects about present and future relationships as well as HIV prevention. The HIV and AIDS surveillance program has been utilized by the state of California to show a breakdown of how many people are affected with HIV and AIDS virus each year. The National HIV and AIDS strategy was designed and put in action so that the amount of infected people would be reduced, as well as keeping the infected persons from being a victim of stereotype. Research. The community researcher partnerships are programs that have been set up within the state of California so that people are able to better understand how to better address and take care of things such as social problems and HIV and AIDS prevention. Although institutional influences like the Catholic Church are not in favor of Latino men living homosexual lifestyles, various programs allow gay Latino men to express their sexuality without feeling confined. The Henry J. Kaiser Family Foundation was founded and set in place because the Latino community has a high rate of people infected with new and existing HIV/AIDS cases. This foundation allows access to testing as well as prevention and care because the virus within the Latino community has become an unevenly distributed epidemic. Essential services of program development. When it comes to preventing the HIV and AIDS virus from continuously being transmitted, it is important to encourage each and every person to get tested at least once a year, along with making sure that they have access to programs that are available within the state of California, such as the SOLAR program. If the Latino men do not feel threatened by discriminatory comments and actions, they will feel better about reaching out to others for encouragement, as well as becoming more educated about the virus and how to apply their knowledge for prevention of further transmission. Existing policies. In the past, individuals who are infected with HIV and AIDS had to worry about getting denied insurance because of their pre-existing condition. Now that it is not an issue because of the Affordable Care Act. Also, there is the Ryan White program, which helps patients pay for services that they need dealing with being infected with HIV and AIDS. The Drug Assistance Program ensures that those who do not have Medicaid and are also infected with HIV and AIDS get their medications through this program that is funded by each state. Assessments. The CDC has been awarded millions of dollars so that they are able to do constant testing of young homosexual and bisexual men who are not aware that they have had the virus. After becoming aware of positive test results, the CDC will monitor those individuals by providing constant medical treatment so that they are able to monitor the viral load suppression rate. The CDC is utilizing various strategies such as the National HIV and AIDS Strategy in order to encourage prevention of the virus. In order to investigate the virus and how quickly it may be spread, researchers are sent to various locations to work within communities to educate and rectify the problem. Policy development. Companies should take the time to educate their employees to not discriminate against those who have or could be infected with the HIV and AIDS. Also, in a lot of larger companies, they should start HIV testing, something which could be completely voluntary, but at the same time encourage them to take the test and be there for them. With PrEP, this would allow for those who may have been in contact with someone who was infected with HIV the chance not to get the virus. Basically, what this treatment does is an individual will take a dose of HIV medication, which is known as an antiretroviral, and it would fight the virus so that they would not become infected. Policy and development continued. The San Francisco AIDS Foundation plays a huge role in the community with empowering, educating, and informing individuals and also developing policies. They allow for the public to be educated about what the virus is and how to live with the disease and how to prevent transmitting the disease. The San Francisco AIDS Foundation has also helped with advocating the Ryan White program and annual budgets dealing with HIV and AIDS. The community works on mobilizing community partnerships with several different sources, such as Under One Roof, which is a retail store, the Richmond Ermit AIDS Foundation, and all proceeds go to funding those who living with HIV and AIDS. The Stop the AIDS Foundation and project work with the community by educating and helping those who are infected with the virus. The Shanti program helps those who are infected deal with the emotional side effects of HIV and AIDS. The San Francisco AIDS Foundation has taken part and helped the city of San Francisco by being part of such programs and policies as the National HIV and AIDS Strategy and even the annual federal budget. This organization is actively involved in being there for those in the community whom are infected or are not sure that they are infected with HIV and AIDS. The reason for choosing this foundation is because they have been around and reduce the rate of infection dramatically, and they take the time to educate the community about the virus. Stakeholders continued. The Channing Chesley Wayne currently works with the Ryan White program as a co-chairman member. Not only that, but she also plays an active role in San Francisco HIV and AIDS prevention program. The reason for choosing her is because she herself is HIV positive, so she is better able to contact with those she is helping on a personal level, and also the fact that she is continuing to work with the community to help improve it. This has concluded part one of our presentations on the infectious disease HIV and AIDS and the impact that it has on homosexual Latino men in San Francisco, California. Thank you for listening.